Hi, this is Dr. J. Park with Medical Weight Loss Training. Traditionally, medical weight loss training focuses on diet, exercise, medication, and psychological strategies. Therefore, many medical weight loss clinics in primary care practices typically offer methods on restricting calories through diet, eliminating calories through exercise, and assisting this process through medications and utilizing various alternative treatments. Many surgical clinics will offer a surgical solution such as bariatric surgery along with diet, exercise, and behavior modification. However, there is a world of weight loss devices in the market. Let's go over some of them. Gastric Band is one of the more common and popular devices on the market right now. Lap band system is a surgically implanted band that is placed around the upper portion of the stomach, which creates a small pouch. The narrow opening between the upper stomach and the lower stomach causes the patient to eat less in one sitting and increases the time it takes for the food to be digested. The system consists of silicone band attached to a tubing that goes to the access port. The opening can be adjusted by inflating or deflating the hollow band. The access port is typically found on the chest wall. The lap band system is typically used for obese adults with a BMI of at least 40 or at least 35 with one or more comorbidities, or at least 100 pounds over the ideal weight, who have tried non-surgical methods in the last 5 years without success. In the US, the average patient lost 36% of the excess weight in 3 years, while some patients lost over 75%, half the patients lost around 25%, and some lost no weight. The procedure is contraindicated in patients who have stomach, intestinal disorders, take aspirin, poor candidate for surgery, and history of alcohol and drug addiction. The risks include nausea, vomiting, heartburn, abdominal pain, and slipping of the band. Now there's also a category called intragastric balloons. There are two of them. One of them is called Obera, and the other is called Obalon. These intragastric systems are balloons that take up space inside of the stomach. With Obera, the balloon is placed endoscopically through the mouth under mild sedation. The balloons are then typically filled with normal saline in different amounts to fit the patient's body structure. The systems are temporary and they're removed after 6 months. It is used in patients with a BMI of 30 to 40 who are unable to lose weight with diet and exercise. In studies, patients lost an average of 21.8 pounds or 10% of their body weight after 6 months. At the 9-month follow-up, patients maintained an average of 19.4 pounds. Contraindications are many, and to see the whole list, please check out our blog. The Obalon balloon system is also a weight loss system that is another gastric balloon system. However, Obalon balloons are delivered by the patient swallowing a capsule that is attached to an inflation catheter. Once the capsule is in the stomach, the balloon is inflated with air. Over a 6-month period, the 3 balloons can be inserted and they're removed with an endoscope. This is approved for patients with a BMI of 30 to 40 who cannot lose weight through diet and exercise. In clinical studies, patients lost an average of 14.4 pounds or 6.6% of the total body weight. The Obalon system is contraindicated in many indications, and to see the whole list, please go to our blog. And finally, there's a system called the Gastric Emptying System. The Aspire Assist is a gastric tube that connects the stomach to the port on the abdominal wall. Therefore, after the patient eats, the patient attaches an external connector device to the abdominal wall and drains the food before it's absorbed and flushes it with water. This device is approved for adults with a BMI of 35 to 55 who cannot lose weight with non-surgical methods. It is actually a long-term solution, unlike the gastric balloons, which must be removed in 6 months. In clinical studies, patients lost an average of 31 pounds or 12% of the total body weight after 1 year. Common side effects include bleeding, irritation, infections, pain, nausea, and vomiting, and changes in bowel habits. There is also an extensive list where this device is contraindicated for To see that, please go check out our blog. So, it should be noted that all the devices above require the use of diet and exercise in conjunction with these therapies. If you're interested in learning how to apply these methods and more to your practice, then please sign up for medical weight loss training at www.medicalweightlosstraining.com. Thank you very much. Have a great day. Bye-bye.